This is the continuation of care of special population: LGBT, lesbian, gay, bisexual, transgender, and queer or questioning individuals, commonly referred to as the LGBTQ community. This group is represented by a wide range of varying characteristics in terms of race, ethnicity, age, socioeconomic status, and identity. There is stigma and discrimination among this population. That is why they are identified as a special population. There is a lack of awareness and understanding among healthcare professionals in managing the healthcare needs of this population. Therefore, access to healthcare to meet their needs is less compared with other population groups. The term sexual orientation describes a person's behavior, identity, and desire. This can be MSM, men who have sex with men; WSW, women who have sex with women; gay, lesbian, asexual, bisexual, pansexual, queer, same-gender loving. Transgender describe individuals who do not identify as a person with their birth sex. Other terms can be MTF, male to female; FTM, female to male. Risk factors among this population may include less access to health care due to stigma, may not have health insurance. Transgender individuals may be less likely than other groups to have certain screenings completed, such as mammograms, breast exams, cervical cancer screening, testicular cancer exams, and prostate screening. Sexually transmitted infections are of concern in this population. HIV and AIDS are more prevalent among certain members of this group, particularly MSM and MTF transgender persons. Syphilis and gonorrhea, human papillomavirus, and anal cancer rates are higher among this population. Lesbians are more likely to be overweight or obese. Gay and bisexual men may be more likely to have eating disorders and body image disorders. Breast cancer and cervical cancer rates tend to be higher among lesbian and bisexual women, likely a result of decreased screening and nulliparity. The LGBTQ population is more likely to smoke than other population groups. Additionally, alcohol and drug abuse may be more common in some individuals. Depression and suicide rates tend to be higher in this group than other population groups. Rejection from friends, family members, and social support systems may be a stressor. Teenage members of the LGBTQ population are more likely to be threatened, bullied, injured, raped, and victimized. LGBTQ youth are at risk for physical abuse by family members due to their sexual orientation. Many same-sex couples desire children. There may be some barriers to child rearing for this population, such as the expenses associated with adoption, artificial insemination, and surrogacy. Healthcare considerations among this population may include creating a welcoming, non-judgmental environment. Measures such as altering signage and paperwork asking for gender identification. Training to work respectfully with the LGBTQ population should be provided for all healthcare personnel. Use open-ended questions and refraining from making judgments during client encounters are important. Health promotion measures should focus on screening for depression, assessing for suicide, and educating on safe sex practices. Additional screening should include HIV blood testing, syphilis blood testing, screening for Neisseria gonorrhea, and chlamydia trachomatis. Hepatitis A vaccination is recommended for MSM. Anoscopy should be used to examine the anus and rectum as indicated, with particular attention paid to those infected with HIV. Mammography and cervical cancer screening should be initiated for lesbian and bisexual women. A careful sexual history and appropriate counseling is important for all members of the LGBTQ population. Non-occupational post-exposure prophylaxis or the use of prophylactic antiretrovirals before and after potential HIV exposure should be initiated. Transgender persons taking hormone therapy need to be monitored at regular intervals. Associated complications such as polycythemia occurring with exogenous testosterone use should be detected and treated early. Transgender persons who have undergone sexual reassignment surgery should have the respective preventive screenings. For example, MTF should have breast cancer screening by way of mammography if they are older than 50 years. Additionally, FTM should still have mammography routinely as indicated due to the risk for residual breast tissue to develop cancerous growth.